Observed.
No objection.
Mr. President, the last few years, I've traveled all over this country talking to people about health care. After listening to countless Americans, including 2 town hall meetings last week, I proposed in the past health care reforms that would have ensured health care coverage was more affordable, accessible, portable, and suitable for all American families. Reforms need to be consistent with our American values of freedom, choice, and limited government. The key to these reforms is put to our citizens in charge of their own health coverage rather than being stuck in a job because the job provides health care. Losing health insurance if the economy causes you to lose your job, we need to change our system and allow Americans to obtain coverage options with a tax credit for policies not limited by state boundaries or government dictates. Just this past week, I had the great good fortune to visit 2 of the finest healthcare institutions in this country. First, I spent time with hundreds of patients, doctors, nurses, and healthcare leaders at the world-renowned MD Anderson Cancer Center in Houston, Texas. I heard from patients who had come to this center of excellence from 90 countries and states, including Arizona. Why do patients come to the United States of America from all over the world? It's because the highest quality health care is in the United States of America. And I repeat, the fundamentals of this discussion and debate sometimes goes astray from the fundamental fact that the highest quality health care in the world is available in the United States of America. The key to it and our challenge is to make that health care available and affordable to all Americans. And the path we're on will destroy the quality of that coverage and will, in fact, make health care the same as it is in other countries, and the reason why they leave there to get high-quality health care in the United States of America. It's the best, our system, because innovation and technology is allowed to flourish. Later in the week, in my home state of Arizona, I visited one of the premier children's hospitals in the country. Phoenix Children's Hospital is a destination medical facility for all children all around the Southwest and in the country. At Phoenix Children's Hospital, I also met with patients, physicians, nurses, medical executives, and average Arizonans. During this visit, not one healthcare provider in Phoenix told me they wanted more government control over healthcare. In fact, they told me the opposite. PCH has experience with Medicaid, and time after time I was told of the problems providers face every day with the government Medicaid program. The program is a vital safety net for the low income, but we have to recognize the important lessons we have already learned about government running health care programs. During these events, I was repeatedly told that we need reform. They also told me about the problems they face in the government-controlled Medicare and Medicaid programs, both with massive unfunded liabilities. They want a stable system that keeps costs under control, gets everyone covered, pays fairly, encourages innovation, and maintains America's standing as providing the best health care in the world. But none of them told me that we need more government control of health care or government-controlled health insurance. I listen to Americans, but I'm worried that they're not being heard here in Congress, who control the agenda in the White House and the Senate. If President Obama and the Democratic leaders were listening, we wouldn't have a bill before us that costs too much, taxes too much, covers too few, and puts government in control at every turn. This country has fought for over 200 years for the fundamental values that I fear are being eroded by the other side's appetite for one-size-fits-all government control of one of our most cherished economic gems. First, this administration takes over the banking industry. Then they take over the auto industry. Along the way, they tell us a $787 billion in more and bigger government, along with $1.8 trillion of debt this year alone, is the answer to our ailing economy. Now they're telling the American people that they were not aware of the economic situation, and guess what? They're going to want another stimulus package. I think that idea would be soundly rejected by the American people. And now they're telling the American people that we must rush to pass a new government health care plan that we can't pay for, will increase taxes and kill jobs. Mr. President, we're talking about 1/6 of the gross national product of America, and it's pretty obvious that the other side wants to jam this through in the next 4 weeks. We should not do that. They still haven't come up with ways to pay for this grandiose takeover of the American health care system. Americans are losing health care coverage every day, and it gets back to the issue of affordability, not quality. But the Democrats can't produce legislation that responsibly makes coverage available to all Americans without trillions of dollars in new spending. This weekend, after a 4-week delay, we finally received new provisions in their new government-run health care plans. Here's what we know about the legislation before us. The Congressional Budget Office says the preliminary cost estimate for the new language they reviewed was nearly $900 billion in new spending. The other side says this is a cost reduction from an earlier version of the bill. Don't be fooled by the smoke and mirrors. After an inexplicable 4-year phase-in that delays several provisions in the Democratic bill in an effort to hide costs through accounting techniques, the bill will actually spend $1.5 trillion when it's fully implemented. And that's not counting the hundreds of billions of dollars in new Medicaid spending promised by that legislation. CBO also tells us the Health Committee bill still leaves over 30 million Americans without coverage. Mr. President, for all the spending being proposed, don't you think we should be covering more than 40% of the uninsured? And when the final numbers come in, don't be surprised if the cost of this, quote, rush proposal is at or above $2 trillion. What's worse, the sponsors can't tell us how we will pay for such a massive price tag. My colleagues and I plan to continue talking to the American public. I suggest the other side in the Senate talk to all Americans about what they need rather than making these decisions for them. Again, Mr. President, we cannot risk running through a legislative proposal in the next 4 to 5 weeks and be sure that we're not making serious and fundamental mistakes. And the serious and fundamental mistake is the approach to this legislation, which is that the quality of health care in America can and must be preserved. It's the cost that needs to be brought under control, and we can bring those costs under control by innovative techniques, by competition, by allowing Americans to go all across America and get the health insurance of their choice, the same way that we've been able to reduce costs in other sectors of